literature review at the start, was make sure that we captured the voice of young people who, maybe more prone to alcohol use, or where alcohol use may have a bigger impact on their lives. And the literature identified a number of groups, and in agreement with the advisory group, we focused in on those who were care experienced, those who had a history of offending, those who had a history of substance misuse, and the LGBTI community. So we included those as extra kind of criteria within the sampling. We approached some organisations that Briege and I had worked with in the past, or with other members of the evaluation advisory group had worked with in the past, to raise awareness of the study, to try and get young people to volunteer. There was a whole kind of suite of documents produced in terms of raising awareness and information for them, and information that went to their parents. There was a lot of work went in before we actually started the field work around ethics and data protection. So I won't go into too much detail, but if anybody has any questions, I'm more than happy to answer that. As well as the young people, we also spoke to just over 20 staff or volunteers who were working with young people. And that was really just to broaden the voice that was being captured by the research, to see if those who work closely with young people had the same view or a slightly different interpretation of young people's alcohol use and any impact of minimum unit pricing. So they were really tended to be youth workers, or guidance teachers, or people who worked in some of the different projects that we worked with, so substance misuse, offending kind of projects. So their findings are integrated within the research throughout. The analysis, and again, I won't go into this in too much detail, but was essentially a thematic analysis where we were looking for the themes that cropped up throughout the research. But obviously, being qualitative, we were just as interested in the voices of those where it was, an isolated voice, or it was very much about capturing different people's experiences. So that's probably enough on that. Hold on. There we go. Just bear with me a sec, just make sure. Right. Okay. So, just before we get into anything about the impact of minimum unit pricing, I just wanted to say a little bit about young people's acquisition. And as I said, this is, I think, some of the most interesting part of the research was the findings around acquisition. Young people, the young people that we spoke to mainly acquired the alcohol from local convenience stores. And this is important because of the point I was making about the impact of minimum unit pricing. None of the young people really got their alcohol from supermarkets. The vast majority of them got it from corner shops or local off licenses near to where they stayed. The main way of doing that was by proxy purchasing. So quite often that would be by strangers, by just stopping random strangers, standing outside the shop and asking strangers what they referred to as jump-ins. Quite often members of the group of young people would do that, whether that would be members of the group who were already over 18 and obviously legally entitled to do that, or sometimes those young people had occasionally had fake ID, or occasionally new shops that would serve underage young people. So that was it. Sometimes siblings were involved, older brothers, older sisters, buying the alcohol for the younger siblings. As I say, sometimes young people were going to outlets where they were known to sell to other young people. Some of the young people that we spoke to, tended to be the 16, 17-year-olds, were going into pubs and going into clubs. And again, some of those had fake IDs. Some of them just knew that they would be served without being challenged. We found that parents had quite a limited role in the acquisition of alcohol. That's not to say they didn't have any role, because some parents would be given alcohol to the young person, maybe at family gatherings or Christmas birthdays, that sort of thing. Occasionally there was examples of parents going into the shop and buying it for the young people, or friends, parents doing that for them. Another interesting way of acquiring alcohol was what young people refer to as charity drinking, which tends to be in a group where 1 or 2 or 3 or 4 members of the group will purchase the alcohol, but that gets passed around the group. There's no contribution made by most of the group to the cost of that. And the drinking that happens in that setting, some people would hardly take any of the drink, some people would take a lot more. It was interesting that stealing was not really a feature of acquisition. Although the workers, some of the workers believed that was the case, none of the young people we spoke to directly said it was, that they either did it or friends within the group did it. It was quite interesting looking at the income of the young people. We didn't gather detailed information on this. There was limited time and limited number of questions, but when it cropped up in the conversation, the income varied hugely, from those who were getting a little bit of pocket money each week to those who were in part-time work. And I think the figures went from something like £10 to £185 a week. So the income did vary hugely, but what was fascinating, I think, was that money in itself didn't tend to be a barrier to young people's acquisition of alcohol. It was interesting, really interesting, when young people were talking about how they acquired the alcohol and when they paid for it or put money towards it, how that came about. So in a lot of cases, it was about alcohol being prioritised. They would be given money from their parents or carers for their lunch or for their bus money or travel money. Quite often they would skip lunch or buy something quite cheap for lunch. So by the end of the week, they would have enough money to buy the alcohol. So for the young people who were involved in our research, certainly the access to money was not really a barrier. When we presented the findings previously to another group, there was quite a lot of questioning around that, but that was certainly the case with the group that we had. In terms of consumption, just let me move that a sec. Some consumption varied quite significantly in terms of the frequency, the amount that young people would drink, but also the product. So, the frequency, we had everything going from young people who would drink maybe 1 or 2 glasses a year, very, very little, to those who were drinking quite frequently, 3, 4 times a week, including just about every weekend. And hand in hand with that, the amount that they would drink would again vary hugely from a couple of drinks, to significant amounts. We had young people who could, barely remember how much. Found it very difficult to remember and quantify when we were asking them about that. I think one of the young people I spoke to had consumed something like 25 units of alcohol in the night before we spoke to them. So again, the amount of alcohol they were drinking, varied massively. The drinks, there was kind of 4 kind of clear categories of drink, if you like, that were popular amongst young people. So we had alcohol pops, we had spirits, particularly vodka, cheaper vodka. We also had wine. Echo Falls was particularly popular, and fortified wine. The infamous Buckfast was amongst those, and beer and cider. But drinks, specific drinks that were popular would be things like Dragon Soup, Cactus Jack, MD 2020. When we looked into the detail of the vast majority of drinks that young people were consuming, bearing in mind that they purchased them in local convenience stores, the vast majority of them were unchanged by minimum unit pricing. So although minimum unit pricing had quite a significant impact on some products, those that were particularly popular with the young people who took part in our study, the vast majority of those were unchanged in price. Computer's going slow again, just bear with me. Okay, so one of the key things which was within the study brief was to look at the observed change amongst young people in the price of alcohol. I should say, I should have said earlier, so apologies for not doing so, the research was undertaken in January to May 2019. Minimum unit pricing was introduced in May 2018. So it was about 8-9 months after minimum unit pricing took place. What we did though was asking people to think back to the time around minimum unit pricing change and think about any change in the drinking from then to when we spoke to them. We tried, certainly in the first instance, in the early parts of the interviews with them, not to talk specifically about minimum unit pricing. One of the things we wanted to check was their awareness of that kind of approach. So we were careful not to mention minimum unit pricing if we could. So we asked them to think about an event or something before May 2018. So when we asked them about any change in price, it was quite interesting. Young people, there was quite a strong awareness that prices had changed over that time period. Some of that was an observed price change. They themselves had been into shops and noticed that the price had changed. But also some of that came from observations or discussions they'd had with other people. So sometimes that would be their friends, sometimes it would be people who were doing the jump-ins for them, sometimes it would be their parents or carers or workers. So there was I think young people were quite aware of the prices. Most of the young people, I should say, were quite aware of the prices. And there were reports that prices had increased, mainly that related to drinks that were popular in terms of the ones that they consumed. So the vodka, the non-branded vodka certainly was impacted by minimum unit price. But young people also reported change in price in drinks such as MD 2020 and Echo Falls, which wasn't actually related to minimum unit pricing, but they were still reporting that there was a change in the price of those products. So there's various kind of, you could put together various reasons why that may have been. Some of it may have just been their recollection. Some of it may well have been price increases, but they certainly weren't they weren't directly caused by minimum unit pricing. Some of the young people we spoke to were aware of a change in the price of drinks that weren't popular with the group. So some young people were aware that the price of the strong white ciders had increased significantly. Some of that was observed in the shops. Some of that was through media stories at the time. But certainly the greatest awareness of change in price, not surprisingly, was amongst those young people who were the ones who were going into the shops and paying for the alcohol. What was really quite interesting in terms of the study was that where the price had been observed to change, young people tend to see that as a small increase. I've got a quote there from one of the young people who at the end says, I noticed a couple of pounds, but not thought, oh, Christ, it's gone up quite a bit or anything like that. So where they had seen a price rise, it certainly wasn't something which had been significant to them. We also asked about the change, any observed change in availability of alcohol in the places where they acquired it from. And generally, there was no change in availability observed. So mainly the drinks that young people wanted to drink were still available. They hadn't really noticed that other products were not available, or that some products were more readily available. So, again, a quote from one of the young people, just saying there's been no change in the shop all the time, and everything that he usually drank was still there. So generally, very little change in availability. There were, though, some isolated examples. Some young people reported that, for example, MD 2020, there was less of that available, or I think one young person was talking about the range of flavours that MD 2020 comes in had reduced. Somebody else, I think, was talking about it just wasn't as available within the shops that they visited. They'd also noticed that some of the strong white ciders were no longer stocked. So again, shows that there was some awareness amongst drinks which weren't popular with young people. So try and get on to the next slide. We asked in detail about any change in acquisition or consumption, their own acquisition and consumption. I think just to reiterate that the majority of young people's favourite drinks didn't change in price, or where it did change, the price was not significant and they were able to pay any difference, so it had next to no kind of impact in that sense. Or that young people, not all of them actually paid for the alcohol, and it was still acquired by other people. So the charity drinking that I was talking about, so in terms of their experience, there was no change. So there's generally no change in acquisition and amongst young people before and after minimum unit pricing. There was certainly no evidence of stealing afterwards or getting other people to fund the purchases of alcohol. There was no change in terms of consumption, in terms of where or when or who with, when young people consumed the alcohol. And there was definitely no evidence of illicit alcohol consumption. Where the picture starts getting quite complicated, and this is, I guess, a kind of reflection of the qualitative methods and the depth interviewing and the focus on lived experience, and in some sense the broader remit of the study, which was looking at some of the factors other than price which drive young people's alcohol. There was some change in the amount and frequency of young people's consumption. So some young people were drinking more this time, when we spoke to them compared to a year previous, so before minimum unit pricing. Some were drinking less, but when we started delving into the reasons for that, it was really quite a complex situation. Price wasn't necessarily a major factor. So Briege will say a bit more about the factors other than the price, which play a part in these complex kind of decisions that young people make. But some of the kind of key ones that were around in terms of people reporting increased or decreased frequency and amount were things like relationships. Whether relationships had improved or got worse. Sometimes that was a driver to drink more. Sometimes it was just maturity. They'd grown up a little bit and maybe grown out of a phase or grown away from a group of friends that they were with at that time. Sometimes, when it was involving increased consumption, it was more to do with just increasing tolerance. So, sometimes particularly when you're looking at the younger age group, the 13, 14-year-olds, a year down the line of drinking, the tolerance had increased. So a number of factors involved there. So for young people who were drinking products where the price had increased, and as I said before, the price increase is not necessarily due to minimum unit pricing, but certainly they reported the price of some of the things they were drinking had increased. What actions did they take? How did they deal with that? How did they address the fact that the drinks that they chose to drink had changed in price or had gone up in price? So for the majority, they took no action for the reasons I mentioned before. That the price rise was generally too small. They had enough money, they'd saved enough, or their income was enough in any case to absorb that price rise. And it's a good quote there from one of the young people. just saying, the price rise would have to be quite significant, before it would have any impact on them and their drinking. And so for the vast majority of the 50 young people that we spoke about, there was just no change, and they took no action. But there was evidence that some young people changed to alternative, cheaper products, and we've got a couple of examples there. One, he bought Cactus Jack for a long time. He'd observed a change in price, and instead of just kind of keeping on paying, which he had done to start with, he decided to change. He'd gone from a bottle of Cactus Jack to 3 cans of dragon soup, and it was a couple of pounds dearer, but he got 3 cans. So it just kind of it signifies, it demonstrates the complex decisions that young people make around the choice of alcohol. Another quote there, just paid the extra bit until about a month ago, and then decided what's the point wasting money, could spend the money on a can and a bottle of Buckfast and still get more pissed than buying the bottle. So again, they will go, and the prices of the products they were buying had gone up, so they decided to go to a cheaper product, not necessarily always just spending less. So in some cases, it was actually costing them more, but they had the income to do that. And there were some examples of the young people we spoke to of purchasing less alcohol. Tend to be young people on a limited income, but their situation was very complicated in terms of the decisions that they made around that, and I think that will kind of become a little bit clearer when Briege talks a little bit more about some of the other factors. So I think this is my last slide, and I'll hand over to Briege.
Okay, thank you very much, Ian. Can you hear me all right? Yeah?
Yeah.
Okay, so yeah, I'm going to kind of discuss the harms and influences in the last bit of this lecture. Basically, we found overall, when we asked people about harms before and after MUP, there's no difference in their lives. But that doesn't mean to say that their lives weren't complicated before, that they're just as complicated. And I think that's a really important thing to reflect on here, is that MUP is a very small factor in their bigger lives. And the young men, there were quite a lot of young men in particular that reported being involved in violence as a result of their alcohol use. There were also some young women who reported that too, albeit to the lesser extent than the young men. And police involvement in vandalism and fire raising was something that was, for a small cohort, they also discussed that as well. And this is one of the quotes from a young man who talked about this, acting completely differently when they've had a drink, and just wanting to square up to people and wanting to hook them one. And workers talked about this, about the vulnerability of these young people who come from the most traumatic backgrounds and feeling angry, and alcohol kind of being the fuel to the fire in terms of how they then act that out. The effects on personal safety were also very relevant in terms of the harms. This was particularly prevalent for young women who both reported it about other young women, but also young women self-reported putting themselves in some dangerous situations. And this is a quote from a young woman saying, "When I'm steaming, I black out, but I've got people who look out for me, so I'm safe. They have my back and won't let me do anything pure stupid." So also the impact on sexual relationships was quite complex. Young people reported alcohol being something that they used to both spur them on to do things that they wanted to do, which was often kissing somebody that they'd fancied for a while. But they also there were some young people who talked about alcohol use playing a part in sexual relationships that they didn't necessarily want to have, or regretted doing them. So it is complex, the harms really, and very individualized, and each young person came with their own story. It's the same picture for the influences. So we asked young people about Oh, so there are other harms. Impact
Sorry.
on health and function. No, you're fine. I've skipped on. So just the young people talked openly about mood swings and alcohol use playing a part in them being hungover. Some had been physically sick, and just generally feeling like, yeah, a bit rubbish after a night of drinking. But some young people, actually, the alcohol use, it's kind of elevated the feelings of anger, and yeah, these were often young people who were the most troubled, if you want, to come from the most complex backgrounds. And again, workers said that they saw this repeatedly, that alcohol played a factor in them, yeah, acting out. And but that wasn't the alcohol's fault, if you want. It was more that this was a trigger to other things that were going on in their lives. Also, young people talked about alcohol being a gateway to other drugs. But they did actually talk about drugs separately to that. Most of the young people we interviewed talked about using drugs and it being very prevalent among their age group. And cannabis use, I'd say, was the most regular in that. We interviewed young people who alternated from smoking one weekend to then drinking the next. But there also was young people who talked about alcohol use being a gateway to taking drugs. And for example, there was one young man said that he only ever takes Valium when he's had quite a lot to drink. So overall, the point of this is that the impact of MUP, there was no difference in health improvement from point A to point B in terms of, when MUP had been implemented. The health improvement for some, there was that they were drinking less, but again, these were young people who had been drinking to a very problematic level, and it actually went to source support, and that was nothing to do with the price of alcohol. That was the reason for them drinking less. It was more that they really felt they had to get a hold on their lives. We also interviewed young men, for example, who had got involved in training programs. They'd been excluded from school, and they talked about how they were drinking less now because of the responsibility of having an employment-based program to attend. So I'll move on to the influences now, which I was in a rush to get to. Sorry. So the point of this is, and I think this is really important to say from the outset, is we asked them what were the influences other than MUP. But actually, these are the most important influences for them overall. And they talked about their friends, which would be no surprise to anybody, being the most important influence. And peer pressure played a part in some of their alcohol use. But actually, it was really interesting that the young people said that generally, actually, they all said this, there's no pressure or there's no stigma around not drinking, which I think is a really encouraging finding from this research, that young people, well, the generation that are coming up, have a different attitude. They're much more accepting and tolerant of letting people just live their lives and not pressurizing them to drink, which I think is really encouraging. Parents and carers were another influence, and Ian has already mentioned this at the start, both in terms of some of them actually helping the young people acquire the drink, but there were a small number of cases where the parents were drinking heavily and drinking along with the young people. It was interesting as well that there were quite a few young people commented on knowing young people who had parents that they could see didn't really care about the young person, and they felt that that was a reason why that young person drank particularly heavy. So there was a self-medication going on in terms of young people feeling neglected in their home life. Identity was a really important aspect of alcohol use as well, both in terms of a rites of passage and feeling like they were becoming adults, and alcohol was kind of this representation of them that they were now becoming adults. And I think that was really strong finding actually in the study. A lot of the young people said that. And there also was identity related to masculinity. So there was quite a lot of the young men in the West Coast in particular talked about Buckfast being quite a key thing for them in terms of drinking and roles of masculinity. Same with the LGBTI group, they talked about how alcohol use, the types of drinks that they choose to drink, are about performing gender. Mental health was mentioned by a small number of young people, and alcohol use being used as a form of self-medication, both in terms of, for example, dealing with anxiety, but also depression. The situational factors for alcohol use were really prevalent, and it's really important to say that this is both in terms of celebrating, which actually most young people talked about alcohol use in a very positive way, about creating a sense of belonging with friends, and just enjoying themselves. But there was also situational factors in terms of, for example, dealing with bereavement, or even in terms of the environment they were in. So if, for example, they were in an empty with lots of friends, they tended to get far more drunk than, say, for example, they were at a smaller kind of social gathering with family, things like that. Life circumstances were really prevalent. I mentioned there about bereavement. That was mentioned a few times by young people. Some young people had actually had, well, a small number of young people had friends who had died from either alcohol and drug use, and that had had an impact on them and their alcohol and drug use as well. But as I say, the most of them talked about life circumstances in terms of having happy things to celebrate, as well as difficulties and challenges in life. And these are just a couple of quotes to kind of illustrate that those different ends of things. I started drinking because I thought it was cool at the start, but now the reason I'm drinking is because it's easy, and when your friends are out, that's what you do. And then you have the opposite picture here, where it's not celebratory, it's about dealing with life. So my dad's never really been in the picture. My mom is an alcoholic and a junkie as well, so I did it to not feel anything. And I think Ian and I have talked about this actually, and framing this as MUP narrows it down, but actually these life experiences that these young people bring to the table, and were really open. They were so open and honest with us about how alcohol use plays such a big role in their lives, but it's part of something so much more complex as well, about how they feel about themselves and their lives, and whether that be positive or negative, the role that it plays. So to conclude then, if we go to the final.
Yeah, there you go. There's that one.
Oh yes, sorry. Actually, we pull this out because I think this is really important, and I think this is, qualitative studies are about what people share and what they open up about, but they might not necessarily have that wider picture view. They might just be able to only really see their own life experience, which is fair enough. And what we know from the SALSA studies, and Eric has talked to us about this as well, is there's this general trend, obviously, of youth drinking in decline. And that's where most of the attention is focused on, I would say, in terms of research, and this very positive experience about young people drinking less. But what we've heard from the workers in particular is that that is not what they're seeing. And as I say, this is purpose of sampling with young people who were drinking. But I think it's important to say that the workers really felt that they could see a big divide happening in society between young people who are vulnerable and living in poverty and young people who are going places. And actually the young people themselves commented on that. They felt that that they were, in some ways, they were kind of being left behind. So I'll give you this quote that the worker had said. She says, "In the media, I see that there is trends that more and more kids are going to the gym, drinking smoothies and going to juice bars, and that is something that is projected. But that might be the case in affluent parts of cities and things, but see in the areas we work out of, not just in this service, but that we have worked in more remote settings, rural settings, that is not what we see. We see young people still taking part in drinking. It is a rite of passage. You have a lot of young people who feel that if they didn't do it, they would have no pals or wouldn't be able to hang out with the pals that they hang out with." I suppose that there's a complexity with that too, again, because it's not just that it's for a negative reason, although some of the workers were really clear that that is why some of the young people are drinking to the extent that they are, and the heaviest drinkers were often drinking for really complex and trying to forget. But there is this celebratory thing as well, but it's just really complex. They just felt like the narrative around young people's decline and the decline in youth drinking is missing, that actually there are young people out there who are drinking now probably more than ever. So I think that's an important thing for us to remember when we're talking about the wider statistical analysis, that there is this group that are drinking more now than ever. So the conclusions and the variation in acquisition and consumption Ian talked about earlier is that actually the way in which they acquire alcohol hasn't changed, but it is really innovative how they get to their alcohol. And the consumption use hadn't changed generally, but for those that had, the reasons for that had not been directly linked to MUP, and again about this wider complexity of their lives. The price of most products popular with young people had been unchanged. So Buckfast, Dragon Soup, and vodka were the main kind of drinks where they could still, the price hadn't went up that much, or it hadn't been changed at all. MUP had limited impact on alcohol use and no impact on the related behaviour, with them reporting the harms and influences being the same as before and after MUP. Price is not a significant factor, and as Ian related to you there, that they do get their hands on their money, and the variance in that was quite vast actually in terms of what they got their hands on, but they still got money and they still had the ability to purchase alcohol, and they prioritised that. The important thing though was to take away is that there were no reported negative impacts as a result of MUP. And we think, Ian and I both think, that actually the key finding from this research is how complex young people's lives are. And actually alcohol use is one factor out of so many others that they think about. So we open it to questions now.
Okay, so I can see. So if I can, I'll kind of try and share this part of the discussion. Briege, Ian, thank you very much. Can I just first of all say that Briege, you highlighted that national and international studies are constantly kind of telling us that youth drinking is in decline, but there's a group of marginalised young people for whom that may not be the case, and that fits with other research that we've done, you and I have done with SHAAP as well.
Yes, absolutely.
Through the FIFA project, where we're finding very different kind of narratives there that highlights the importance of qualitative studies. So related to that, I've got a question from Natasha Buckham asking about where young people get their alcohol from. Is the fact that these young people don't get their alcohol from parents or guardians significant in relation to this study? Does that make a difference?
Ian, do you want to take this, or do you want me to take it?
Probably be better if you did, for the very fact that Eric was breaking up when
okay. So basically, I think parents definitely do play a role in it, but I would say the role that they play is more about their drinking habits and what they model to young people. So those that were drinking problematically, we definitely did see a link, albeit remember this is a small study and these are small numbers, but they did say that had an influence on their drinking behaviour. For those parents that actually were buying the alcohol though for the young people, and if you want, had supervised drinking, they drank probably the least out of the whole sample actually. And the young people who talked about having a drink at a party, say, with parents, so it wasn't like lots of drinking every weekend. It was an odd party here, an odd party there where they were allowed to have a drink. They drank very, very little actually. So the behaviour that the parents model in terms of their drinking is really important factor. I don't think them buying the alcohol is as important, but when they do buy it, it's normally supervised drinking. So I think it's more about the overall behaviour that they're modelling rather than that simple factor of buying.
It didn't sound like they had any difficulty getting alcohol from anywhere, from what you're saying.
No, absolutely nothing. No difficulty at all. And it was, as Ian said, mostly from jump-ins, getting it from strangers or getting older friends or siblings to buy it for them. So
I want to ask you about kind of some of the conclusions of this, picking up on Vic Troy's question. If she wants to add to this. Sorry, I meant to say, Natasha, if you wanted to kind of come in and add more to kind of what I said there, please do so as well. So Vic was asking about kind of whether MUP wasn't a factor because we were basically buying their alcohol from small local shops, which might be more expensive anyway. From what you said, it was different products, so it was products that wouldn't be affected particularly by minimum pricing wherever they were buying it. Is that right?
Yeah, that's right. Yeah, that's absolutely right.
That's definitely true. Yeah. But they also, I think, the fact that they bought it from the local store was partly, or mainly, partly was convenience, but also because they knew they would get served there. I think the perception was that trying to get it from the supermarket was, just pointless for on the off licenses. And those who, was only a handful of young people who did drink in pubs and clubs, and they again tended to know which ones they were going to get served in or had fake ID.
So what do you think the study tells us about minimum pricing and these young people then? You know, it almost sounds like you're almost saying not very much.
I think the point is that actually they kind of.
I think the
Well, I'm looking at Vic's question specifically was, do you think this is an indication that the 50p price is too low?
Yeah,
But if
yeah.
the 50p price wasn't ever going to affect these products at all, anyway, it's a bit relevant to.
Yeah, but then who was MUP really for? It wasn't for this cohort of young people, you know.
Yeah.
And I think that's testament to the fact that the products were affected.
Yeah, no,
People aren't drinking them.
That's absolutely right, isn't it? I mean, that MUP wasn't designed to address underage drinking. That wasn't, you know, that wasn't the key driver for it. There may have been some impact, or bigger impact, or maybe in the future if the minimum unit price was increased. I think the fact that, you know, the vast majority of drinks that young people purchase and where they get them from weren't affected immediately makes MUP, you know, not the policy that is, if you were looking to combat underage drinking, wouldn't be the right way. Not at 50p. I think if it was higher, I think it might have some effect. That's just a personal view. But I think you would need to raise that 50p quite considerably, given the fact that young people prioritise, or the young people we spoke to, prioritise their alcohol consumption, and that money really wasn't an issue. So if you made it 55p, I think it would have next to no impact. You know, if you made it 60, 70, I think you'd need to go up quite a lot before it started really having any impact on.
And then you would likely have some other unintended consequences for other populations for whom minimum pricing at 50p might actually be far more effective. Can I ask Carl Ferguson to come in? Carl Ferguson's making a really interesting kind of comment on this about suggesting that that testing the effect of MUP and framing this study as being about that might distract from other interesting findings. Can I ask Carl to come in if he has got something if he wants to discuss that more?
Yeah, thanks, Eric. In large part, I think that Vic's point and the conversation afterwards kind of answered my main kind of query, which was that minimum unit pricing wasn't designed with young people and children's drinking in mind. The logic model, for example, whenever it mentions children, it talks about children and young people as victims of adults drinking rather than being concerned with their own consumption. One thing that occurred to me from that previous discussion was it might be quite an relatively easy thing to do to try and estimate what the average price per unit would be across the drinks that young people are drinking from this study, or at least might give an indication. So we could quite quickly compute some kind of thresholds. I'm not sure that threshold will be informative in and of itself. Like Eric pointed out, there's other population groups to consider, but there could be, we could do more than guess what kind of threshold might be useful to affect young people's drinking. But yeah, I think most of my point was actually covered in the previous conversation. It is worth, I think this study is very interesting because it's got interesting findings, sure, but I find myself constantly having to tell myself to forget about MUP and look at what the findings were. And as a disclaimer, I'm a public health intelligence advisor with Public Health Scotland. I'm on the MUP evaluation team. So I have that additional lens. But yeah, I thought the most interesting implications of this study don't really pertain to minimum unit pricing so much as they do to the strategies and patterns of consumption for young people, children.
No, I'm glad you agree, Carl, because that is the one thing that Briege and I, whenever we talk about this study, we would always say that the actual really interesting part of it is the insight it gives into a particular group of young people, but their acquisition and consumption levels. If it helps, I can very quickly just put a bit of more detail to the other point you were making about the average price of drinks, and I'll give you some examples which we had in the report. So Buckfast was 60 pence per unit, so 10 pence above the threshold. Dragon Soup is around about, on average, 75 pence per unit. MD 2020 is 80 pence per unit. Cactus Jack's 67 pence per unit. Echo Falls 84 pence per unit. They're all the average price in local convenience stores in Scotland, and that was very helpful information we got from one of the other studies in the MUP portfolio about the sales. They've got really detailed data on sales in local convenience stores across Scotland. So really, that was really helpful information for us. But it shows, the vast majority of those were about 60, 70, 80 pence per unit.
So if you wanted to increase it, sorry, go ahead, Eric.
No, carry on. Carol, you finished? Or are you?
I was just going to point out then that if we did want to introduce a price floor, hypothetically, that was looking at children and young people's drinking, it would need to be vastly higher than 50 pence per unit to have an effect just going on those averages.
Which again may have unintended consequences. Well, it's likely to have unintended consequences in other areas. Can I ask you to the two of you about I'm noticing the other questions as well about kind of when these young people started drinking, because clearly you were selecting a cohort who had been drinking already. When did they start drinking? And also, Ian, you alluded to transitions and something like transitions to adulthood as being important in terms of influencing perhaps continued or changing behaviour in relation to this, I think. I don't know if you had anything to say about that.
So they most of them about 12, wasn't that right, Ian? They said they started drinking, and they talked about their alcohol use in terms of feeling like they were growing up. So when we talk about transition to adulthood, it's kind of a notional thing about when they thought they were, being seen as being older, and they talked about feeling more mature and their tolerance levels going up, and some of them talked about drinking more then as a result.
Why did they drink though? Because it's like there was one of your quotes kind of said, it talked about getting pissed, so it sounded like that for that young person that this was the entire purpose of it. Why did they drink more generally? Was it just that it was around them, or was it that it was related to feeling adult, or?
It's basically a lot of it's about just being with friends and enjoying themselves and not being part of the social scene and nothing else to do. And so boredom, social scene, sense of belonging, and it is what young people in these areas and in these groups are still doing. So they're not going to the juice bars, they're not meeting in the juice bars, they're still meeting in the park and getting drunk.
I think, well, some of the young people were drinking earlier. I think the earliest that I remember, one of the young men I spoke to was 7 or 8. It's really, really young. There was other ones who talked about being drunk when they were at primary school. So still, under 11 or whatever it would be. And what was quite clear with most of that group of young people, or with those examples, was that alcohol was part of their life, or part of the people in their life. The young guy who was drinking when he was 7 was staying with his grandparents, who one of those was alcohol dependent. There was always cans lying around the house. There was older siblings who got him drinking, maybe thought it was amusing at the time to give him cans. And I think that, for some young people is why they drink, because it's around them. I'm not saying that's for all young people, but I certainly think it was part of the equation for some of them.
Can I ask you didn't say much about safety and violence. You didn't say very much about violence. My own research, I found violence and safety as being really important issues in relation to young people.
No, they definitely were. Quite a few of the young men reported getting involved in violence, but so did a very small number of young women as well. and personal safety was particularly important for the young women, and them getting themselves in really like just blanking out and then relying on friends to get them home and things. So it definitely was part of what was reported by the young people, and fire raising as well, and police involvement in their lives as well for some of the young people. And because we did have we had a group of young people who were involved officially in offending, so they were, you know, partaking in an offender behaviour program, if you want. So there was definitely reports of that, and alcohol playing a role in that.
Yep, I'm just running down some of the chat here. So Malcolm has asked a question about, is there data on the number of prosecutions for sale to young people or proxy purchases for young people? I'm assuming that must be included in MESAS, but somebody else can correct me if it's not and is somewhere else. Jane Ford's correctly kind of drawing attention to the fact that this is a young group of people already known to be drinking. Yet is a qualitative study, so that's that's what it's about, and it's helping us understand their life context. Can I ask Peter Rice to come in here? So Peter's drawn attention to SALSIS, and Peter, maybe you could just explain what SALSIS is for. I know we've got some people who are not from Scotland, so maybe you could explain what that is and some of the differentiation and similarities to the findings in SALSIS that you've drawn attention to in your comments.
Yeah, sure, happy to. If you can't hear me, I'll hear from you. Tell me you can't hear me, so you can hear me, can you? Can you hear me, Eric?
I'm having difficulty hearing you. I don't know how other people are.
I can hear a bit.
Okay. Yeah. Yeah, so the SALSIS study is a long-running, probably going back more than 20 years, like 25 years, maybe every 3-4 years, a study of alcohol experience of 13 and 15-year-olds in Scottish schools.
That's
so
better. That's better. Can you stay where you are? Because I wasn't able to hear you. I can hear you now, so stay where you are. Right.
Okay, so yeah, so the study is of 13, 15-year-olds in Scottish schools. There's been a series of samples which I personally find decreases value of it. You know, it measures trends pretty well, and that has been one of the sources of the thing you were talking that was being discussed earlier, of the downward trend in young people's use in Scotland. Pretty substantial changes in the SALSIS findings from say the mid-1990s to, you know, through to the millennium, with a little bit of an uptake in more recent years. So that's a very brief summary of SALSIS. But my question was within SALSIS, proxy purchase by relatives and including parents is the commonest source of acquisition for young people in that study is very, very different from Briege and Ian's work. So I guess that did make me wonder how the purpose of sampling was, you know, so it's a half-hearted apology for getting quantitative about it. I mean, how many of the young people were not care experienced, how many had not offended, how many were not receiving social support, you know, social care or healthcare interventions of some sort. So I fully understand, I think, the reasons for the purpose of sampling, but I suppose my question is how purposeful were it, and you know, because I think it's important just for interpreting the, you know, the findings that you've reported.
Okay. Do you want me to take that, Ian, or do you want to? Yeah. Can you hear that? So, okay, so basically, we remember we had a slide there about the breakdown of the 50, and we had within that there was a cohort of young people, or cohorts of young people who were care experienced, who had a history of offending, LGBTI, and we basically had for 4 groups. I remember we identified through the literature review, we thought we definitely need to get a small group of them. But in terms of acquisition, that came out from the discussions we had with the young people. We didn't go in with that as being a criteria from the outset. So we didn't use that as being in any way representative. So that wasn't a key factor before we approached the groups, if you want. We just found out that information through the interviews.
Okay, thank you. And Peter, I don't know if you said this, I was finding it difficult to hear all that you said. So that young people paying more for their alcohol was identified at the start of the modelling underpinning MUP. So that was part of the thinking behind the policy. And can I just say, Chris has picked up, and I think I've raised this with you, Briege, and on a privately. There was a bullet point about illicit alcohol use, and is it not all illicit alcohol use for these young people? Did you mean something specific?
Yeah, we just mean like they're not making their own brews. They're not cooking up vodka themselves.
Right. So it's
that just to put that in context. That was one of the specific questions posed in the brief. You know, whether if minimum unit pricing was having an impact on young people's drinking, whether they were then switching to drugs or switching to illicit alcohol. But technically, you're right. You know, it's all illicit. And if I can just very quickly just go back to that point about proxy purchasing. Not to answer the question because I don't know about the number of prosecutions, but I do know in the discussions we had after the study, the study was kind of signed off by NHS Health Scotland and Scottish Government. That was one of the things that really jumped out with the policy folk and the Scottish Government about how easy it was for these young people to get alcohol. So they were, you know, very interested in the implications that has for proxy purchasing and licensing. I know, you know, I physically sat in a meeting with some of the licensing folk and the alcohol policy team from the Scottish Government, and I know that was one of the things that particularly concerned them.
Okay.
There's also a question, Eric, if I can, about what role sport played. And I know, Briege, you had a young person, didn't you, who was quite a sporty person who it definitely had some impact on the alcohol consumption. I can't remember the details, but I'm sure you can.
Yeah, I wanted to pick that up, Briege, and ask you kind of whether you linked any of your findings from your other research into young people in sport with this study.
No, because we only had one young person who talked openly about sport being a factor in their lives, and it supports the research we're doing in another piece of work of FIFA, that sport is a really underutilised factor in these communities. And I do think there's something about the link with that with poverty though too, the lack of amenities and services in some of the areas that, you know, cost money to play on 5-side pitches that people don't utilise the local services the way that they should be. So I think sport could play a far bigger role as a diversionary activity for young people, and in a way that they can achieve sense of belonging with friends, that doesn't have to be through alcohol. So one young woman, that's who reported she was trying to play at quite a high level, and she said she only drank once during the weekend, and it would only be every other weekend rather than every weekend. But that was one young person out of the sample of 50 that talked about sport.
And that would be related to the level of sport as well. If you're operating at a very competitive level, then you might be more likely to be looking at your alcohol use. Chris, it was your kind of point that you raised. Do you want to kind of add anything or kind of ask anything more in relation to that?
I think that participating in sports, just whether, you know, it revolved around watching football, you know, in the park on the phones, anything else like that. But if no one else spoke about it during the interviews, then
it just wasn't an influence with these young people. Again, I suppose this is like the levels of marginality or how marginalised they are, that they just don't fit the normal, what you would think young people are engaging in. So, but I definitely think we need to be looking at that, at the positive role that sports could be playing. So yeah.
Can I ask you, because obviously kind of when we're talking about the mantra that we have for kind of for promoting health around alcohol is like price, availability and marketing. So so obviously the study's about price, and you've talked a lot about availability. Did they say much about marketing and advertising and whether that had an impact on their behaviours? Would they have said that, do you think, if it had been important?
Do you know, funny, they didn't say advertising, but it definitely was part of the image and identity for some of them. So for example, Buckfast, that masculinity and playing out that type of image of themselves as hard men, if you want, was definitely, for some of the young men that we interviewed, they were open and honest about that. as playing a role. So there is but that's not obvious marketing, isn't it? It's like a cultural thing rather than advertising. And
how about social media? How about people, well, both being advertised to, whether they know it or not, on social media, and their peers kind of sharing kind of drinking stories on social media? Did they talk about that?
They did talk about the influence of their peers on social media, but they didn't talk about the advertisements. So, and the peers, they said, had much more of an impact on social media than anything else. So, yeah, advertising wasn't as big a factor, but you are right about social media and the impact of peers.
I think it's although advertising wasn't talked about, I think if you look at some of the drinks that are popular amongst young people and you look at the packaging of them, we're getting into quite, different territory here, but if you look at Dragon Soup and Cactus Jack, and you look at the look of the cans, and some of them are caffeinated. I think Dragon Soup's quite heavily caffeinated. Some people might, choosing my words carefully, some people might think they were aimed at younger people. I'm sure the producers of them would, would say they're not. But if you look at them, so I think the findings would be quite relevant to anybody who was looking at advertising of alcohol products to young people, including underage young people. I think that's probably as much as we would safely say on that issue.
Yeah. Can I ask Vic, do you want to add, Vic's got a question that she wanted to ask about kind of parental drinking and relationships with parents. Do you want to kind of say that?
It was more just to kind of pick up on whether people actually talked about it or not. I know that Carl had said obviously MUP was in order to protect young people from their parents drinking rather than from their drinking themselves. I know that wasn't the focus of your interviews, but did any of the young people that you spoke to talk about how their relationships, their safety, their well-being had changed because of their parents drinking patterns changing? And did any of the young people directly link that to the MUP?
So we had nobody report that their parents had had any impact on their drinking through MUP. Nobody. So no, we never got that at all. At all.
There was another study which was part of the portfolio which Jane Forward, who I know is in the room, she led that one, which looked pretty much at that issue. So I don't know if Jane wants to say something. Hi, Jane.
I was just going to invite Jane in, because Jane, you've also raised some discussion of some of the other studies, so maybe you could tell us a bit about those as well.
I probably can't say too much about the other studies, if I'm being completely honest. I was just scribbling about on our website trying to find some information about the detail of the crime study and what's included in that. So I might ask Carl if he knows any more about it. But certainly, to answer Malcolm's question, there was the compliance study, was one of the first to be, well, it was the first to be published. And that did show quite high compliance with MUP, but it didn't really report on any instances of people getting things on tick or selling to underage drinkers. So we don't yet have that information as part of the portfolio, but there might also be other stuff in the small retailers study that's just recently been published. And the impact on health and social care part of the and crime part of the portfolio, the crime study is just in the process of being commissioned. So if you keep an eye on the website, I can't work out how to share the link on my iPad, I'm afraid. I'm not very technical in that sense, but if you keep an eye on the MUP website, there should be more detail about the crime study coming on there quite soon. And then just in answer to the last question, so we've just recently, in March, trying to think back now, published a separate study that looked at the impact of MUP on harm to children and young people, or the potential for MUP to protect children and young people from harm from parents and carers harmful drinking. And we weren't able to say from that study whether or not MUP did have an impact. What it did show quite clearly was the extent and the nature of the harms that children and young people do experience as a result of parents and carers who are drinking at a harmful level. But beyond that, we weren't able to say weren't able to draw any conclusions about the effectiveness of MUP on that group. But there is a separate report on the website that will give you more detail on that, and I'd be happy to discuss at a future meeting if that would be helpful to people.
It would be. Can I ask Ian and Briege, it's like we're hearing a lot about policy being informed by the science at the moment in relation to COVID. How do you think that how well do you think that your study is informing or should be informing policy, and how do you react and how do you respond when you have your study being misrepresented in the media? As researchers, what do you do to combat that? What resources do you have to combat that? Easy questions here. Not putting you on the spot or anything.
You want me? I'll answer some of that. give you time to think of an answer as well.
Do you feel pressurised as well by advocates to find things that the advocates want to find, or are you able to kind of be properly independent? How do you manage those tensions?
I don't think we did on this study, to be honest. I think when the study was published, to go back to one of the earlier points, a lot of the headlines which you flagged up yourself, Eric, in your introduction, and a lot of the stuff on Twitter was just an absolute load of rubbish. And how did I feel about it? I was quite annoyed, but not surprised that people were totally misinterpreting and totally missing the point, and talk about it being not representative and didn't find this or that.
Actually, can I say from an advocacy perspective, I actually felt like that we've had all these we've had preliminary studies coming out which show that MUP is having positive impacts. It's almost like some people saw this and thought, this is fantastic, this is one that's saying it's not working and we're going to make a big noise about it not working. But I didn't read your paper as saying that at all.
No, I think the problem isn't it, that people just want a black and white picture, and that this is complex, and that's what the report shows, is that we draw attention to the whole totality of these young people's lives. And actually, we didn't search for these things. This all came from the young people and the analysis of the data, which we did it right. We did a spreadsheet and everything, which is unheard of for research. But and genuinely, I think you have to just say what it is. You can't be bending the findings to your will. But we didn't have to here. I think we were very honest that this picture is complex, and it's 50 young people's lives. You can only say so much about MUP if you look at the whole big picture, which is what they did. When we asked these questions about the influences, they told us straight up that it is about their friends, it is about their life circumstances, it is about their situations, and price is a small factor that, as we've said, they will find ways to get their hands on it anyway. They'll prioritise that. Even if they are only getting £10 a week, they'll still find money out of that to buy alcohol. So I think the strength in this is, if you look at this wider picture and ask, what are the stories that these young people are telling us about their lives? What really should we be paying attention to? And what they're talking about is they are in situations where they're from bereaved families, where there is alcohol use, problematic alcohol use, that there is pressures in school. They were talking about that as well, that they feel pressures, that some of them are drinking to self-medicate, but some of them are drinking to actually feel a sense of belonging with friends, and this isn't a wholly negative thing. So it's complex, and people should take that alongside the quantitative analysis that exists on MISAS, and recognise that these are young people who probably are not doing these surveys, who are not at the moment having a voice at all, so we should be listening to them.
So would you say that you're researchers and advocates at the same time? Can you be researchers and advocates at the same time?
I think you can, but I think the data is where it's at. We're putting out what the stories are that these young people are reporting. We're not trying to slant it in any way. But I think we have to be honest that Ian and I we were very keen to have young people who we know are drinking problematically. They're not just drinking, we know they're drinking problematically as a cohort, and we wanted their voices to be a part of this report. And Yeah, I think in a way that is a role of advocacy, isn't it? That you're making sure that the minority voices are being heard.
Informed by evidence.
Yeah.
Yeah. Can I just say that Carl and Jane, thanks very much. You've been putting up links to the MUP portfolio. I think if people just Google Public Health Scotland alcohol, you should be able to find the studies there as well. Can I ask Liz from SHAAP has a question that she wanted to ask. So Liz, it's over to you.
Yeah, hi. Thanks so much, Briege and Ian. That was really, really fascinating presentation. And actually, it was just to pick up on this question of, you know, what we should be focusing on and the question of advocacy. And it really strikes me that some of the sort of unexpected things that came out from your research, like the potential for this gap to be widening between some young people drinking in some areas and other young people. And then also, you know, the point that you made, Briege, about the lack of amenities around certain kind of sporting facilities or, you know, such like, and that young people sometimes drink out of boredom. It just strikes me a little bit that, I can't remember who said this, but I remember attending a presentation where someone said, you know, we can't take something away without giving something back. And I think that's quite important, because the question of whether MUP by itself is going to solve some of these issues, whether it's young people's drinking, whether it's the impact of parental drinking on young people, sort of needs to go along with a package of policies that also address some of the issues facing the communities that some of these young people are kind of living in. And so I think you're right that potentially focusing simply on MUP without kind of looking at that broader context or what other policies to do with alcohol it's going along with sort of maybe misses the point. And I just wondered what you thought about that.
Yeah, and I think you're completely correct. This is not a silver bullet, but I don't, like, even, you know, Carl had mentioned this as well, and Eric had said it, and, you know, MUP wasn't designed for this group of people. But this sheds light, I think, on, yeah, you're right, this inequality. And I think there is, I think that worker is saying something that's very real. And I think the census studies tell one story, but this cohort of young people are telling another. And there are real differences here, that they're about inequalities, they're about poverty, they're about, you know, opportunities and communities being, in some cases, very much kind of forgotten. So I think this is I think this is a part of a wider issue, isn't it, about inequalities and the growth of inequalities. And actually COVID, I think, is really bringing to the fore the fact that people are really, they don't want that anymore. That, you know, we see this with the Black Lives Matter, we see inequality. And I think the problem with maybe is that we need to bring this back again to the poverty and the disadvantage. You know, it's race is part of that as well. But in Scotland, it's about poverty and inequalities, and we should be shouting from the rooftops that things need to change. And these young people they are the victims of that. They're the victims of inequalities. So yeah, I completely agree with you, but it just seems so overwhelming about where do you start then. But I do know this, like, 10 years of austerity have not helped. So yeah.
Peter's just shared with us that there's a tiny number of licence holders who have their licences revoked or suspended annually. That related to a previous part of our discussion. I'm going to just ask Briege and Ian to kind of just make some kind of final comments in relation to in relation to recommendations for policy and practice from this study. I guess one of the things I've just noted that I think is really important is that the young people you describe are not passive victims of things happening to them. They may experience disadvantage, but they have agency. They have considerable agency to make decisions for themselves and also to influence the decisions of other people round about them. I also think that one of the really neglected things in youth studies is that we older people can sometimes learn a lot from young people rather than us always having to kind of be telling young people what to do and how they should behave. If they're saying that they have agency to decide not to drink if they don't want to, or not to get into dangerous situations if they don't want to, maybe they have something to teach the rest of us. But anyway, I want to kind of pass back to you two. Final comments in relation to recommendations for policy and practice from this study. So, Briege, do you want to go first, and then Ian?
I think my key thing would be that this is part of a wider picture about inequalities and poverty, and that is where we need to be challenging things. Like, we need to be doing better for these young people in terms of keeping them in school. And school exclusions, for example, I would say is probably one of the key things I would be really looking at. And we know from the Edinburgh Youth Transition Study that these are the young people that go on to then come into our prisons and into our institutions. So for me, if there was one thing we'd look at, it was trying to keep young people in school and giving them opportunities and hope that they can do better. So that would be the top thing for me.
Yeah, I think for me, what I would take from this, and you know, if I was to make any recommendations, I think it shows quite clearly that price is not really the way to address underage drinking. I guess you could do if you ramp the minimum unit price right up, but you know, there'd be massive consequences not just for young people, but for many other sectors of society. I think also my plea from this, you know, on the basis of having listened to the young people, is actually if you were going to, you know, if you wanted to address underage drinking, the proxy purchasing might be one way, but I'm quite open-minded on all this. If you'd really need to have a massive kind of overall approach to young people, if you were going to clamp down on their underage drinking, you know, to make it almost impossible for them to get hold of alcohol, then you really need to think about what else you're doing for young people, because otherwise, especially this group of young people, what are they going to do? You know, you can't just take away alcohol and then just think everything's going to be fine. You need to think about other activities and support for them and why they got in that situation in the first place. So I don't know if that answers your question or, or probably not, but I think that was my take from this is the lessons it gives you in terms of young people's lives, much more interesting than what it does or doesn't say. It does or doesn't say about minimum unit pricing.
Thank you very much for that. I thought it's all about kind of providing opportunities and spaces for young people and respect and dignity for them and not stigmatizing them. Listen, thank you so much for that. I'm really disappointed with all of you on this session today that we haven't had one cat pass the screen. So that's really disappointing. Seriously, I can see loads of people will be dragging their cat to the camera now. Thank you very much. Please don't assault your cat. Thank you very much, Ian, Briege. I think it's a really important study. For those of you who haven't read it, please do read it. It's rich. There's loads to learn from it, over and beyond minimum unit pricing. Thank you for coming here.
No, thank you. Thank you very much for having us.
Joining the
Thanks
discussion.
everybody else. Thank you.
And please, everybody, do come back on the 7th of July for problematic substance use in later life. Thank you very much, everybody. Take care and be safe.
Thank you.
Thank you.